Good evening. I'm Nina Sperano. We begin tonight with a health alert over an increase in RSV cases across the state. The Wisconsin Department of Health and Human Services is reporting more than 800 cases of the respiratory virus in the past week. Margaret Cahill shows us how this is putting a big strain on local hospitals.
800. That's how many RSV cases Wisconsin saw in the past week, according to the Department of Health Services, which they say is up significantly from this time last year.
The first time in my 10 years here that I've been worried about not having a bed here. Also, kids seem to be sicker with it.
Dr. Nicole Schwendel is a pediatrician at SSM Health in Fond du Lac. She says RSV, or respiratory syncytial virus infection, poses a threat to young children specifically.
They have smaller airways, and so one of the things that happens with RSV is it can cause a lot of mucus and other just kind of junkiness within the airway.
Dr. Abby Smolcich, a pediatrician with Theta Care in Appleton, says they've also seen an influx of RSV patients.
We are sort of stretched to the max as far as available beds for kids who need to be hospitalized.
Dr. Joshua Ross with UW Health says loosening COVID-19 restrictions could have contributed to the spike in cases this fall. He says cases right now are about 3 times what they were this time last year.
We're no longer masked and distanced as we needed to be during the early parts of the pandemic. And so understandably, kids are going to be around each other, and which is good, but they're also spreading viruses.
But COVID-19 hasn't gone away yet, and neither has the flu, creating the possibility of hospitals becoming overwhelmed dealing with all 3 viruses.
You know, as much as you might have doctors working as hard as they can, there are only so many beds, there's only so many breathing treatment machines, there's only so many other, x-ray machines, things like that, that can easily be overwhelmed.
All 3 physicians say parents should be on the lookout for symptoms and check with their primary care doctor before coming to the emergency room. In Fond du Lac, I'm Margaret Cahill, NBC 26.
Doctors say most children will handle the virus just fine, but up to 3%, especially infants, may see worsening symptoms and difficulty breathing that can lead to a hospital visit. Symptoms parents should look for include nasal flaring, coughing, fever, difficulty breathing, or a runny nose. Now, if these symptoms persist or a child's breathing becomes too strained, physicians advise parents check in with a primary care doctor or go to their nearest hospital.